Welcome back, 725. Continuing the conversation with Dr. Liprie on sleep apnea.
Thank you.
Yeah. I'm enjoying this. No, we're learning a lot. Very interesting. Let's continue on here with anatomy and some of the symptoms.
Right. So we talked before the break about the anatomy, how the base of the tongue kind of closes. You start gasping for air. Again, this can happen 4 or more times an hour, so you never sleep.
I can't even imagine what the next day looks like.
Oh, it's horrific.
Yeah.
And you get so used to it, a lot of these folks don't know. It's their sleep partners that bring them in and say, this is crazy.
I imagine this. So the snoring is probably one of the biggest indicators, right?
Oh, yeah.
Physically that you can hear or see.
Oh, absolutely. The second most common thing is I fall asleep at red lights. Just the minute it takes waiting in traffic's enough to cause them to go out. They're that chronically tired.
Wow.
Almost a classic mnemonic.
That's how you know, right? Look for that.
Yeah. And then I guess a little physiology, because I'm loading you up today.
Yeah.
When we breathe, we inhale oxygen, but we blow off CO2. That's respiration. Sleep apnea patients aren't blowing off that CO2, so they're waking with dry mouths and headaches. It's a high CO2 level as well.
Very
from
interesting.
Not breathing.
We've got about 45 seconds, so let's talk treatments if we can jump into that.
The little mask that fits over the face blows positive pressure to keep the airway open.
Okay.
It's called CPAP. Little dental appliances that pull the jaw forward helps you to breathe. And then the most novel thing now is a little stimulator, a little nerve implant at the base of the tongue.
Oh, wow.
Oh, yeah. It senses when you're not breathing, fires off the base of the tongue, pulls that musculature forward so you can breathe.
So real quick here before we wrap, it's like a procedure. So now we're to that point
it is
where
an
you
implant.
can get it. Wow.
Yeah, it's pretty cool.
That's crazy. Very
Just got
cool.
approved.
All of this, super interesting. We'll get this up online for folks at home so they can refer back and learn a little more about sleep apnea. Love this topic. Dr. Liprie, we appreciate you. Thank
Always
you.
fun.
We are going to send it to Storm Track 15 meteorologist Adam Olivier for a quick check of the weather.